translation as usual. So.
Oh, sure. And hoping that more people do come.
Yeah.
Yeah.
Well, welcome everyone. This is our 9th Learning Collaborative. We're happy that you can join us, and I hope everyone was able to have a safe and happy holiday weekend. It's good to be back. This, as usual, this is a place where we all, everyone that has attended our trainings is invited to participate and engage with their peers, and also our team here at Public Health. And because of this just current year, where most of our learning collaboratives have been focused on COVID-19 resources and topics that you all have requested to be a focus during this time together. So as you can tell, that we were trying to set up Spanish translation with Patty, and the Spanish translation takes place on the Skype call. So if you are able to, if someone needs Spanish translation, you can always just put your number in the chat box, and then Patty will reach out. It doesn't look like it doesn't look like there's many attendees in Spanish today, but usually we've had folks attend on that line. All right, so we will go ahead and share the agenda for today. This is, we'll go ahead and do introductions in the beginning, and then I will share a few COVID-19 updates. And then Penny, who has always joined us, will facilitate this more of a focused discussion on navigating difficult conversations with patients and clients at this time. So without further ado, can we have folks introduce themselves? Either by phone or by chat, if you're comfortable.
Well, hi, I'll break the silence. I'm Jim Stout, general pediatrician, professor of pediatrics at UW. I clinically work at Odessa Brown Children's Clinic, and I'm the co-PI on this project with Brad Kramer, who leads it.
Hello, everyone. This is Joyce McCraney. I am one of the community health workers that is working on this asthma project with the team as well.
Hi, this is Brad Kramer, also with the asthma team in King County, and my coworker Colby over there. Sorry about that.
And hi, this is Penny Brewer, and we'll be talking later about how we can work with difficult situations, particularly around resistance, later this afternoon.
Hi, everyone. My name is Elodia Andres. I'm from Tacoma Pierce County Health Department. I'm a CHW. I work in the Healthy Homes program with kids with asthma, adults with COPD, and also a resources navigator. Right now I'm doing a lot of diaper deliveries. So I'm going to those families that can't go out and can't get diapers and don't have transportation. So I just got back home from doing some diaper delivery. So I'm just doing porch drop-offs. I'm not having any contact with nobody. So I'm having lunch right now. So that's why I put my mute and no camera.
You don't get to see what you're eating. Huh?
Just holiday leftovers still.
Oh, yes. That's great.
Yes. Nice to see everyone.
Hello, my name is Adelina, and I work for Youth and Family Link in Longview, Washington. And I work as a CHW and outreach and engagement specialist for families and working with children with 0-18 years old. And so just connect them to whatever medical stuff they needed. And especially right now due to COVID, working with COVID clients and connect them to resources and stuff they need, like medications, food, and whatever they need during the quarantine and stuff. So that's what we do. at Longview, Washington.
Hi, Lena, is this your first time joining us from Youth and Family Link?
She muted herself.
Oh, I think you should unmute, try to unmute if you can.
Okay. We did one training at Longview, Washington last time, in person.
Oh, that you came to our in-person, but is this your first time in our learning?
Yes, yes,
Okay.
this is my first time here, sorry.
Welcome. No, that's okay, welcome.
Yeah.
Well, I'm George Valentine from Love Overwhelming in Longview, Washington, healthcare for the homeless, outreach and engagement, and I'm a community health worker.
All right, and it looks like we have a few folks introducing themselves on the chat. We have Nancy from Mary Bridge Clean Air for Kids program. Welcome, Nancy. We also have Anna from Coordinated Care, so welcome. Anyone else? I see Sandra, but I think we're having trouble hearing you. I see your name light up, so you might be muted. But welcome, Sandra, as well. All right. So I should just one more point as far as logistics. I should have most of everybody should be receiving emails from me. So that's one of the reasons. Hi, Sandra. I see you from Mason Health. Yay, welcome. One of the ways that you would have gotten the invite would have been through email, but just in case, if you haven't been receiving emails, maybe you got this invitation forwarded to you by a colleague. If you haven't been receiving emails from me, if you can just please enter your email in the chat box and we'll make sure that you'll be added and updated to the mailing list. All right, so we'll go ahead and get started with a few COVID-19 updates, and then Penny will help and present. Awesome. Okay, and it looks like we're all set up with Spanish translation as well. So just a quick update as far as like statewide. Folks have been asking about what's open and what's not. I think we get that question a lot from several patients and clients, and a little bit about the background behind each of those activities. It differs a little bit, but for the most part, this is right now the phase that we're in is until December 14th. This was announced by Governor Jaisley on November 17th. So between November 17th and December 14th, this is the most up-to-date list of what's open and what's not and what's the limitations. So I put together a few of these slides that if you would like to have handy maybe when you're speaking with folks, but it breaks it down by topic. So for example, the first one is recreation. A few limitations are on outdoor only sports. So for adult and youth sports, hunting, skiing, camping, golf and tennis, all those things are allowed outdoors only, are required. A few limitations by like water facilities. So things like swimming pools and some of those things may be open by appointment only in some counties. So that's the limitations as far as recreations go. This is the big one was the announcement around gatherings. Indoor gatherings with people who don't live with you are prohibited unless you quarantine for 14 days prior to the gathering or quarantine for 7 days and receive a negative COVID-19 test result. So this was an announcement that was made prior to the holidays, and for the most part, I actually was in a presentation this morning that for the most part, a lot of people did follow this rule, but we are still kind of all holding our breath for about next week where numbers will come in to see if people did a good job of quarantining and limiting their gatherings during the holidays. But indoor gatherings are not recommended with people who don't live with you. But if you are meeting with and gathering with people outside, then the recommendation is no more than 5 people who do not live with you per week. And this is one of those things that people had the most questions about, is like who can gather and how many people can we, get together with. So that's the recommendation. And definitely the focus is on quarantining prior to any gathering, or quarantining for 7 days if you have a COVID-19 test result. A couple more points on gatherings. Some having had questions about in like faith-based gatherings. So any spiritual or religious services, they've been limited to 25% capacity. So that has decreased. I believe it was 50% prior to that November 17th deadline. So now it's down to 25% capacity. The 200 people is for like a large church or mosque, or whatever is less though is what's recommended, and face masks are required. There's a couple of points about in-home faith-based services or counseling. Weddings and funeral ceremonies are limited to 30 people. And for long-term care facilities, only outdoor visitation is recommended right now, because indoor visitation is restricted to mostly having essential support workers. As far as travel, everyone is encouraged to stay home, or at least in the region, and avoid all non-essential travels to other states and countries. And then people that are arriving from other states or countries, including Washington residents, they should self-quarantine for 4 days after arrival. And then this is a long list about what's open and what's not as far as businesses and services. And this is probably the more complicated part of the phase that we're in right now, just because there's always that ongoing conversation between having things, especially small businesses, not be negatively impacted by the stay-at-home orders, but there is limited indoor capacity for some of these things, and most of them are outdoor only. So for when you receive the slides, you'll have a link to each specific one. If you want like more information on what's open for museums, or what's the restrictions on photography sessions, or anything like that, you'll be able to learn more about that. But for the most part, like for example, restaurants are only open for outdoor dining and to-go only. So indoor dining has been prohibited. For most of the retail stores, in-store purchases are allowed with limited capacity. So if you've gone out at all, you've noticed that most businesses are following these restrictions, and they're following the mask mandate, and making sure that they're not letting too many people indoors in at once, if they are allowed to have indoor attendance. So there's a lot of different requirements based on the business or the service. But for the most part, it's been mostly just outdoor services that are allowed.
Walter.
Does anyone have any questions as far as these guidelines that I just shared here, the past 3 slides? I know I kind of rushed through it. I do want to make sure that we have enough time for like Penny's presentation, but
I assume grocery stores and food markets are part of the retail services. I didn't see them listed separately.
Yeah, so they're open also with limited capacity. So usually a store would have like something printed on the front saying like, this is how many people were allowed in.
Yeah, because I heard that big box retail stores were a major place that people were actually sharing their COVID. Did you hear this as well?
Yeah, so the DOH has a report that I can share a link to. It says like where outside of the most popular way that people are contracting COVID is through like gatherings through household gatherings. That's like the most, and community gatherings. So not following the rules that way. other ways, the most other popular one is through restaurants and retail. That was the highest way that people have been contracting COVID. The second one was like through folks that have to be in an agricultural or farm work setting. That seems to be popular. Construction sites also. I can try to share a link to that report as well, but you're right. It does seem to be in places of retail and restaurants. That's kind of like where people get it. So just real quick, I guess this was a fun image that was passed around by our friends in the Snohomish Health District. So they passed this out before Thanksgiving, and they're just letting people know that your flock is bigger than you think it is. So are you keeping your flock safe and small? So even though we're doing our best to stop this COVID-19, the virus is sneaky and can pass quickly from one person to another, often without showing any symptoms until it's too late. We can definitely all do our part by not gathering indoors with people from outside of our household. So there's like that, you see that turkey that says you, and you think that you have a flock of those 5 folks that you are interacting with, but really they're also interacting. They might also be interacting with another 5 who might also be interacting with another 3. You know what I mean? So it's just kind of, it's a lot bigger. Our circle of people that we're interacting with is a lot bigger than we think it is when it comes to, making sure that we're not passing the virus from one person and another. So even though you may have control about where you're going, you don't really have control over like where other people are going and who they're interacting with and what's happening there. So I thought that was a cute little figure. If you wanted to share that with folks as far as letting people know that their circle may be bigger than you think. So just real quickly, this is we always like to touch base on seeing what's happening with the data. So this is another link to the data dashboard from the DOH, and it links by confirmed cases, by hospitalizations, and by deaths. So the most up-to-date number that they have as of November 28th, right now we're at 162,700 cases with hospitalizations around 10,759. And with deaths around 2,703. So the percent of deaths that they calculate is around 1.7%, where they take the number of deaths divided by the confirmed cases, and that's kind of like the rate of what's happening here with COVID, looking at it by statewide. And then if you look to the right where the bars are, you can see the breakdown by county. And the highest currently is King County. So we can go to the King County website and look closer at the numbers there. So this is the data dashboard from Public Health Seattle, King County. You see the numbers of positive there, 43,740 positive cases. And what it does is it shows you how many new cases since yesterday. So this is from today. So since yesterday, we had 356 cases. And it breaks it down for the past 14 days. So the past 2 weeks, that number there is what's been alarming, is that 15.4% of the past cases have been positive. So for the past 2 weeks, we've been at a 15% rate, and that's where you see that big spike over there on the line graph, where we've been steadily increasing since October. But hopefully we're on the downturn after this week. But it's been steadily increasing. The other number that's also alarming is the 7.3% of all positive cases has led to hospitalization. And then 2% of all positive cases has led to death. So that's what these are the numbers and percentages that our data folks and our health officials are keeping their eye on, is making sure that we're not increasing the rate of hospitalizations and the rate of deaths of all these cases that are coming in. Any questions on the data dashboards? Okay. So that's it for me as far as the just the quick COVID-19 updates. I took a little bit longer than I should have, so I apologize, but I will pass over the mic to Penny for this discussion.
Thank you. Well, hello, everyone. It's really wonderful to be able to chat about motivational interviewing with you, and hopefully we can do some problem solving together. I wanted to ask you first, if we could just brainstorm, what are some of the issues, the difficult situations that you've come up with? What are some of the difficult conversations that you have found have been hard for you? And I thought before we even get started, I would find out what some of those are. Anybody want to share? Just throw something out about that.
The biggest thing that I've ran into was just the lack of resources that I'm able to utilize going to the Department of Licensing or DSHS for reviews, and even just the doctor's office in general. It's hard to be able to get my clients in to get a appointment over, because most of my folks don't have reliable phones. So it just makes it more difficult for me.
Right. And in terms of your relationship with your clients, do some of them get really mad at you or frustrated with you, or anything?
Not so much me. They more vent to me. They run to me for advice and stuff. But
Sure.
luckily, I don't have that problem with them blowing up on me. So
Okay. Oh, that's good. That means you have a really good relationship with them. Yeah, they see you as their advocate and their helper. Great. But that's such a hard situation. I mean, that's so big, and that's what we're facing all over the country right now, isn't it? Lack of resources for
the biggest,
so many people.
even my folks that have working phones, most of them living in the encampment and don't have power, so they used to go to coffee shops to charge their phones, and restaurants, and all of that's shut down now. So now we're just trying to find places for them to even charge their phones. So
Wow.
it's
Oh.
yeah, it's something.
Yeah. Are there any churches or anything that have outdoor plugs where they can go and plug in their phones or anything?
Well, that is actually one of the resources. I am pretty resourceful on that note. So we do have a couple little hidden spots where they alternate, and we're able to do that outside the churches. But it is definitely difficult.
Yes, I can imagine. Well, George, just from the little I know about you, you are such a resourceful, flexible, kind person. And
Thank you.
You offer so much to your clients. And that's huge. I hope you know that.
Thank you.
Really. Anyone else have situations where you've tried to have a conversation about a situation with their home situation, their asthma control, anything like that, and you found that they've been resistant or angry or whatever?
One of the issues they have with my clients is that they not let you know what they have in their house or what they don't. So they don't want to really share information. So we deliver food for some of them, especially like I mentioned early, COVID clients. And some of them, it seems like they lack in space inside their house. Just like they don't want to it looks mess, you know, but they don't want to really share what's going on inside. And especially now that we don't have access to go in, so
Right.
it's hard to find out what is going on. And one problem that we face is that when we deliver food, they're afraid even to consume like the cans, the culture, I guess, because people don't eat the same food as others. So canned food for them, it's just like something strange, and they just don't use it. And so they call me back and say, you know what, I don't use canned food, so I don't even know how to use it. And so we basically find out that they drop the food outside so we can pick it up again. And it's like a waste, you know. But we see when we meet with them like this little confusion of them if we want to talk about asthma, want to talk about things that it happened, and they just don't want to address it because they think they confuse us as a CHWs as a CPS workers. So they think we are CPS and we investigating what's going on with them and we want to take the kids away. So they're afraid of that. So if they see you with a budget and hanging on you, they think you are something from the state. They will take the kids away and they just don't want to talk about it, even though they have issues from asthma or whatever health issues.
So it's been really hard to build trust and
Right.
to build relationship because you don't have that opportunity to come in and spend time together and laugh together and share stories and be able to say, look, I'm here just to help you and to provide help and resources that you might need. Yeah. So are you able to do any of that when you're on the phone with them, or is it hard for them to talk on the phone too?
Because Youth and Family Link offer face-to-face communication with them before. Started in March, we stopped doing face-to-face. Everything is through the phone right now, but even through the phone, we have to connect them to like I say, food. That's our main resource now for them. We don't see face-to-face, but we schedule time we can meet with them at home, drop their food. We just drop and go. We don't have like direct contact. It's just hard. It's been hard
It's really hard.
It is.
Right.
It is. And
like on a nice sunny day, you could actually stand on the porch with masks on,
yes,
feet apart, but not many days are like that, and not everybody has an outdoor place to be. Is that part of the issue too?
and they're afraid because they think because you're working on the outside and you drop in food, they think you've been meeting with other people too, and they are in their house. They're afraid to meet with you. So that's a barrier in there too. And most of the challenges is the language barriers too, like Spanish to English and Chuukese and dialects, different dialects from Guatemala and dialects from Guatemala, Mexico basically have different dialects. Spanish is their secondary language. English will be a third language. So I've been dealing with this multi-language things.
What a challenging job you have right now. Oh my goodness sakes. How many dialects are there that you?
In Guatemala, I think from Guatemala, I have like about 6 different dialects that they spoke. And Mexico, it's just about 3 of them. It's like Mixteco and another Mije and another dialect. So it's not even a translation for them. And I've been having a hard time to connect them to translations and fill it up forms and ask for help. And it's just not easy. The language is one of my biggest challenge to communicate with others, and it had been a rough time, especially due to COVID. Before I connect with them face to face, I can show them pictures, I can show them examples, I can say, look, this is how it looks. I can use my phone and Google the information. But right now, it just like they don't even know how to use Zoom. And I do like the moms group, like the GPS model for moms who have babies from 0 to to 3 years old. And basically, they don't know how to use Zoom. Some of my clients, they never went to school. They only went to first grade. Some of them never show up to school. So it's another, the reading, just their knowledge is less than anybody else. So that's my challenges and my issues that I have. And I have multiple clients. Basically, I have about 67 families in charge right now. And it's just a bunch.
Oh my goodness sakes, Adelina. There's a challenge a minute, you know, really.
Yes,
And
it
all of
is.
them require different solutions. Yeah. So do any of them have older children that can speak English with you, or does that help at all when there's another child working together with the parent?
I've been managed my time to spoke with the Chuki's interpreter. She's working for the South Kelso team and Kelso, Washington. And I've been do 3 ways call, so I can just speak in English them and Chuki's. So we do 3 ways call. And when I connect them to medical care, 3 ways call too. So that's my go. And so it haven't been easy, but I trying to manage my time and connect them as much as I can. And the rate for the COVID clients that we have is like in the Latino and Hispanic community right now going an increment.
Yeah.
So I
Yes.
I feel like we are overwhelmed with that too. And I did have like about 10 to 12 clients with COVID plus my other families, normal clients. So it's been a rough time, and I feel locked down because I could not move. I could not do what I used to do before. So
Yeah. Well, I can tell you're being such a big support for them. They will understand at some point, but right now it
it's hard.
takes such courage and strength to keep doing what you're doing and keep finding resources. Yeah.
I do. And sometimes it's just the lack of resources just for connect them like payment for bills, housing,
Yeah.
electric, and all that stuff. It's just been an issue. Sometimes the funds are people running out of funds and stuff like that. So it haven't been easy to connect them to multiple resources. But thank God, Fish is working with us hand by hand and provide food and medications and a thermometer or whatever they need. So
Who is
we
who's
provide
providing?
fish,
Fish.
yes. Fish or Salvation Army. They were
Yeah.
our go-to for COVID clients. They helping us with all that.
Wonderful.
Yes.
Yeah. Well, maybe we can talk about the canned goods at some point later. The other issues are actually so big, and I'm so glad you have at least one interpreter who can be there for you as well, because 67 families to take care of is a lot of families.
They are a lot, and they have multiple children with different needs, like or Down syndrome, to any other needs that they have. Just it's difficult to deal all legal cases and all that. So I need like mental, legal, medical, and food resources. So I basically depend on all the community. Any resources that are available are welcome.
Absolutely. Where are you located?
Right now, I am in Clascanay, Oregon, and I work in Longview, Washington, Collins County.
Cowlitz County. Okay.
Yes.
All right. Yeah, I don't know. I do know that the governor has issued, there's money available for people who didn't get the check from the federal government. I'm sure you've tapped into that
I
situation.
have that, but they not let me access for some reason. So I just send the link for clients. I know they need it, and it's just been a challenge. It's
Yeah,
even for applications, it's just been a challenge.
because
They
you
not
want to help them. Yeah,
yes. So
right. Oh, we could spend the whole hour with you.
Yeah, let's get moving on. Thank
Yeah,
you.
but we better move on. Thank you. Anyone else have an issue that they want to present? Okay. Well, we'll go ahead and just as a reminder from that first time we were together talking about motivational interviewing, what is it? Well, it's a collaborative. That means we work together, and it's a goal-oriented communication where there's particular attention paid to the language of change, which means it's designed to strengthen personal motivation for and commitment to a specific goal. And we do that by eliciting, asking questions, and exploring the person's own reasons for wanting to change. And we do it within an atmosphere of acceptance and compassion. That's a long description, but it kind of it captures sort of who we are, the spirit, which is acceptance, compassion, collaboration, working together. And I can see that in every single CHW person I've worked with. Okay, next slide. So resistance, we talk about resistance in motivational interviewing because often clients, they know what they're supposed to do, but they're not ready to do it. So resistance can be a result of our desire to keep people from going down the wrong path and to set things right. And often that can lead to our pushing our client too quickly for a behavior change when the client is ambivalent about the change and isn't ready for that planning. And so instead, we'll spend lots of time defending against the change. Any questions or thoughts about that? Does that make sense? You know, where we're trying to push too fast when we work with clients. And resistance can be the result of our desire to keep people, well, yeah, so we've talked about that. So it's when there's ambivalence and we want to move too fast, then we get resistance. Yeah, okay. So what we want to do is keep dancing with our clients instead of wrestling with our clients. And so one of the ways that we can help with resistance is to pay attention carefully to what they're saying and reflect back what we've heard. So when the person is not ready and upset, what is that? Is that somebody trying to say something? No, okay. So validating the feelings by expressing empathy so the client knows that you understand. And the purpose is to lower resistance and move toward collaboration again. And can you think of some ways that you have used reflective listening when people have been upset about something and you said, I can see you're really upset, or things look really hard for you right now, or things don't really make sense. Anything like that where people sort of understand that you're really trying to hear them and understand them and be with them. Because it's all about, with motivational interviewing, it's all about wanting to understand their point of view, what's going on for them, letting them know they're the ones in charge, but we want to be able to help in whatever way we can that will support them in having a better life. So we use reflective listening a lot when we're talking together. Alidia, how do I pronounce your name? Adelina? Adelina. So if the if your client said, oh, I don't want these cans, I can't use these cans. And then you said, so you don't understand how to you don't feel safe with those cans.
Yes. So some of them, I think they get confusion with the due date, like the expiration date and the sell by. So they confuse sell by due date. They think it's educated. So what I do, use the phone and educate them through the phone and say, you know what, this is how you can do it. It's beans, so you can do this and this and this. So I teach them even cooking lessons on the phone. How they can do it. It's green beans, you can use this in this way. And so just trying to teach them different ways, especially in the Hispanic community, they use different ways to do things. So I say, open it. It's just trying to make like it's a real food from homemade stuff.
But
So just
that it doesn't have to be homemade to be safe.
yes, just educate them how to do it and teach them how to prepare it different. So put different tasted. If it needs salt, add a little bit of salt. If it needs something else, if it's like soup or something, add vegetables on it. So they feel like, okay, so I can do that. So then later on, oh yes, you're right. That wasn't that bad.
Oh, good. Okay.
So
Thank
trying
you.
to teach them.
Thank you. Yes, that's the big secret too. And then sometimes when people are resistant, we just need to validate that, you know, we're in this together. Next slide.
Yes.
Next slide, please. Number 3. Another way that we can help people is to offer new and positive interpretation of negative information provided by the client. And I use the example of smoking in this, but we could use all kinds of examples. So in this one, my family members are always nagging me to quit smoking. And you could say, sounds like your family cares a lot about you. That's reframing what they are saying and offering them a new way of looking at a situation rather than seeing it as nagging, but oh, I could see it a little bit differently. Next slide. And then there are often times when we need to shift focus when we're talking with our clients, where we need to move the focus away from obstacles and barriers. An example, if the problem is time that keeps them from considering change, then say, well, let's pretend you have 6 more hours in the day. What would you do? Can you think of an obstacle that comes to mind where you could actually use the shifting of focus to help them see it in a different way? George, can you see anything with your clients? No? Okay. I can't hear you. Yeah, you're on mute. Yeah.
I'm going to pass this time.
Oh, okay. That's fine. That's good. Anybody else have one where, you know, they come up with obstacles, but you could actually have them consider a different way of looking at the change? Okay, we'll move to the next one. And then there's agreeing with a twist. And this is where it's, yes, it sounds like this is a really bad time for you to think about changing your diet. And so let's focus on something that actually would actually make a difference for you. So you're reflecting the agreement and then reframing and moving on. Next slide, please. And then always emphasizing personal choice. So this is acknowledging the autonomy of the client. And in the end, it is he or she who determines what is happening. So no matter what we may think is helpful, always let them know, well, you're the one in charge, not me. We're just offering some consideration and some advice, but it's really up to you. Next slide. And often we have resistance when people have misinformation, and we've seen that a lot. So one of the ones with asthma that we've run into so much is there is no way my house can be clean without using bleach. Or my child doesn't need any more medicine. He has rescue medicine and that works just fine. And my Chihuahua dog helps me with my asthma. Those are pretty common things that we've heard in our asthma study. Can you think of some other misinformation that you have heard in your work with your clients?
I have something to ask, especially due to this pandemic right now. The Department of Health, basically, they provide us bleach for all COVID clients. Basically, that's what we provide,
They
cleaning supplies
offer
with
what? I'm
bleach.
sorry. They offer what?
Bleach.
Oh,
Clorox, whatever is that. So to cleaning, and we teach them how to dilute the bleach so they can clean up where they're being isolated from the family. So that the Department of Health does the things that will, like hand sanitizer and all this bleach and Clorox wipes and all that stuff. So it just, it's not a way to, they can say no to that things. Basically, that's what we, Lysols and all this.
you're right. You're right. We're in a whole new world.
Yeah, well, everything is with bleach on it now. So it's just like, if
Yeah.
not 99.9% germ killer, it's not good. So I'm not sure how we can educate our clients not to use that kind of stuff anymore.
Yes, you are right about that. What we can do is do what you do, which is to talk about the importance of diluting and not having too much, and the importance of not being exposed to too much bleach if they have asthma or their children have asthma, because it really can harm the lungs. And luckily, when you dilute it to like what is your recommendation? I mean, I've heard from childcare centers, but what is your recommendation?
Basically, what we do is just like 5 liters of water. We just put a little drop of bleach.
Perfect.
5
Okay.
liters.
Yeah.
And so just a little bit, and
Right.
use whatever things. Don't wipe you color stuff at home. Just trying to clean up the bases where you mostly touch, but
Right.
not all over the house.
Right.
Yes.
And just remember that vinegar is really helpful too. It's very, very helpful in keeping
I use it.
clean.
I use it. It works well.
Right. Anybody else have a question or thought about these examples? Okay, next slide, please. So when we hear some misinformation, we want to explore that with them. So for instance, oh, I can't use cans. They're not safe. And so you would reflect back. So canned goods don't feel safe to you. No, let's go back, please. Let's go back.
Sorry about that, Penny.
That's okay. No, there we
There we
go.
go.
Okay. And then ask your client, well, what do you know about canned food? And that's when they can say, oh, I just don't feel safe. I don't, it may not be good. I only use things that I like to cook myself. And then you would say, well, may I share just some information that I've learned uh, as I've been working with other clients, and usually they say, oh, yes. And then you'd say, I just want you to know that canned goods can be a wonderful source of food for you. And this is the way you can tell if the can is still safe to use. And not only is canned goods, are they safe to use, they're a wonderful way for you to stock your pantry in case you have run out of fresh food. Then you will always have some good food to eat, and that will keep your family satisfied. What do you think about this? Ask, what do you think about this? And then wait to hear what your client has to say. And it may seem like a lot more talking for to get to this point, but what you're doing is you're putting them in charge. You're sharing information, but they're always the one in charge, and you're checking to see how they feel about that. Does that seem to make sense to you, or is there something more you need to know? And in this way, we are constantly putting them in charge of what they want to do. Can you think of other situations where you would want to use this kind of sharing information? Anybody from the group? George, yes.
I actually ran into that a few years ago. There was a partnered agency that actually put on a demonstration of how to cook with food that you get from the food pantry with canned goods and how to cook nutritional food with it. I'd have to try to find out which group it was, but it was a really educational piece. It was really had good talking points in it. It showed that most people wouldn't eat the canned goods and how you can still eat nutritional with it in a meal plan. It was pretty cool.
That's great, George. Well, and just to let them know that actually canned food can be nutritional.
Oh, absolutely.
It can be nutritious. And yeah, and the point I'm making with motivational interviewing is that you're checking to see where they are, what they know about it, sharing your information, and then finding out how they feel about that, if they have any questions or concerns about that. And you would do it like with medication, with staying in isolation, any of those issues that come up that are difficult, where they're not sure they want to do it, and they're really confused and upset and not wanting it, and reflect what their concern is, and then ask if they know anything about this particular situation, this particular advice, and how would they be interested in learning something that you have learned, and then providing the information and asking the client for a reaction.
Another talking point I did, I went with one of my clients to a nutritional doctor a while back and informed him that you can get all your nutritions from eating the right fruits and vegetables instead of having to take the daily supplements. And it blew his mind. And we got printouts, and I've used those still to this day. So it was pretty cool.
Great. I love that you keep doing research and growing, George. Keep helping your clients. Both you and Adelina do so much for your clients. It's really, really exciting. How about the rest of you? Anybody have any situations that have come up where they've had to share information, or they've had to work with resistance that has been difficult for them, that we could problem solve together and look at? No? Okay. Let's go to the next slide. So I would love to do a role play with someone, or talk with someone about any of these ways that we can work with resistance. I know it's really hard to do these things on Zoom. It's so much easier when we're in a room together and we can do work together, but Anybody have any issues where we could do some problem solving together? Adelina, I was thinking about your situation where it's hard for them to store food and you don't really know what's going on. And I wondered, what are some of the ways that you approach them when they don't want you to know what's going on for them?
Basically teach them how to organize their cans and like in boxes or
Mhm.
something that not can be spread all over in the house. And in the kitchen they can find like a special door where they can just store food. And that way I just trying to talk to them about it and just put it in boxes and put it by date. So what is the from the newest to the oldest one, so put the olds on top and the new ones on the bottom, and that way you will use the by
And
aspiration.
do they accept your advice, or do they seem?
They do.
Oh,
Basically
okay.
say,
Oh.
if you get new food every time, you should store the old food in front. So you have like a pantry.
Yeah, yeah.
So it stores the old food in front, so you can consume that before, and the new one just put it in the back. So and they say, okay, that's a good advice. Thank you. So
You're a very good problem solver, right?
yeah.
Okay, all right. Yeah, well, I am so much of dealing with difficult situations is just trying to get a sense of what's going on in their life and being there for them, and providing as much compassion and empathy as you possibly can. And empathy is, for us, empathy is actually reflecting what their concerns are and then moving into what areas are they concerned about and need help with. What do they see as really important for them to make a change? And what I'm hearing today is that so much of the concern is basic, how to keep living in COVID, how to have enough food, how to get to the doctor. I'm not hearing from other people, but these are the things I'm hearing from George and Adelina, that it's really not situations about whether their children are using the right medicine. It's really, how is the family getting enough food, and how are they going to pay their rent? And these are all issues where the problem solving has to be really intense, but at the same time, so much of it is the kind of empathy and care that we can show our clients, even when we can't offer something as solid as, yes, I can get you to the doctor. Yes, I can get you money. But having someone that listens to them, who cares about them, who is concerned about them and their family and how they're doing, and then finding ways to actually provide whatever service is available to them. But more than that, provide the kind of social support that is so necessary right now. And not being afraid to ask them how they're feeling about how their life is going. Not being afraid to offer support and find out what is really happening in their life and in their home and with their children, and being supportive and giving them the kind of care and concern and support that is so necessary right now. When people are in isolation, or they can't see their friends and family, they can't go places, they can't do things they're normally not able to do, taking the time to find out how they're doing, finding out what their concerns are. Their concern could be the fact that, they don't get to see the friends that are really important to them. And maybe you can't change that, but by speaking and with empathy, reflecting back what you've heard from them. So it's really hard not being able to see your friends. And when you can use that kind of reflection, then they have an opportunity to talk about it and to actually possibly even problem solve some of the situations when you talk in this kind of way with them. Like, so are there ways that you can be in contact with them by phone? Finding out things like that. Some of the situations that you will run into now with COVID may not have anything to do with food or shelter, but have to do with emotion and have to do with feeling lonely and feeling isolated. And so taking the time to discuss some of these things with them can make an enormous difference. Have any of you found that to be true in your work together?
Emotional distress, that's one of the biggest points that I've been dealing with.
Mhm,
They emotionally ill, like they crying, they exciting, like how can I want to pay my rent? How can I pay this?
mhm.
How can my kids don't have a daycare? So daycare is another one of the issues right now too.
Yeah,
And so, and another reports that I've been having is that people, they could not quarantine due to multiple hoops that they have to jump in order to get support from the community.
yeah,
So I have to answer this big questionnaire about myself, about my family, about my kids, about everybody in order to I can get my bill paid. So they afraid to go through so much hoops and questions and so much digging into bring this, bring that, and that. So they literally cry. The
yeah,
emotional distress and stress out just to find support, it's heavy.
yeah.
And I cannot imagine how many times I have to hear my clients crying about that. And how can I get out? How can I not find support? How can nobody help me? You know, it's just not good.
Mm-hmm. But do you feel that when you interact with them and you let them know and you reflect, oh, it's that your life is really so hard right now. This you can that you actually are giving them support, even though they're not getting that resource.
Yes, I do connect them to multiple resources like Columbia Wellness and stuff like that. Multiple like mental health they
Yeah,
need
but I
it.
mean
Uh,
you. I mean you.
and me, yes, I offer
No,
my help. Like
yeah,
I say,
yeah.
I'm
No, but I
here.
mean, just yeah, just having a talk with them and being
Yes.
able to express that is so important right now. Yeah,
Yes, I've been doing that.
yeah,
So basically
good.
give my time just to listen.
Yeah,
Sometimes I know we need to whine and everything, and like I say, okay, I just listen to them. I just say,
yeah,
okay, let's chat about this. I know we are together in this. Let's keep moving forward. And if you need any help, I'm here. You call me, text me, or
yeah.
do whatever you need to do to feel safe.
Great. George, you were going to say something.
I was talking with one of the elders at church. It's not quite work related, but it was a reflective talk we had. Um, she was telling me that this is her first Christmas without her mother, and she's 65 years old. So her mom, was up there, but um, how hard it was and difficult because she always go to her mom's house for Thanksgiving and
Mhm.
with the big family. And she was saying how it was just her and her husband and one of her grandkids, and she usually cooked for a massive amount of people. And she said it was terrible. And I just sat there and talked to her for until she got it all out. And yeah, I could tell that it was just a relief off of her just to sit there and listen and reflect.
Absolutely.
Oh, I'm sorry to hear that, and how it was just it was touching. So
Yeah,
definitely,
yeah. And that was very healing for her.
yeah.
Very healing. Yeah. Anyone else? Anyone on the staff that want to talk about it? Joyce? Nuha?
No, I think this has been really insightful. Thank you, Penny.
Okay, well, I hope this has been helpful. I find this to be one of the most challenging times in my life, and I'm pretty darn old. And I think that you are doing sacred work right now. You are taking care of people who are vulnerable, who are in incredible need, and that the work you do and the compassion and the empathy that you show is so healing for them. And I don't want you to forget that, because the way we are with each other can make an enormous difference in whether a person is going to feel safer and more whole or feel diminished and less. And so the more we can show empathy and think about discussing hard things, reflecting back what we hear, and being able to share their concerns and their sorrows and be there for them, can make an enormous difference in their lives. So thank you very much.
Thank you, Penny.
Mhm.
I just want to wrap up. Just saying, just to open up the floor for anyone, if you had any additional questions or any comments in general. Also, just a quick reminder for everyone to complete the survey that I've sent by email about like your caseload, about asthma patients. All of that information is just really important for us to get an update about like what everybody's caseloads are looking like as far as patients and just post-training evaluation that we need to be on top of. So if you haven't received a survey link from me, please just enter your email in the chat.
Thank you, Penny. You also do sacred work, and I really appreciate you.
Thank you. Thank you. It's so wonderful to be with you even on Zoom. And I hope everyone had a wonderful Thanksgiving. A very different one, but a wonderful one. Yeah,
Thank you.
thank you.
Thanks all. This concludes our learning collaborative. And